I'm Dr. Guru Prakash, consultant cardiologist at Yashoda Hospitals, Somajiguda, Hyderabad. Many of cardiac patients will be asking what is the ideal time for exercise and what is the ideal type of exercise. So there are ACC guidelines in this line of recommendation. They say that any patient who exercises 5 days in a week, 30 minutes per day, that is amounting to around 150 minutes of exercise per throughout week, is mild to moderate exercise. Mild to moderate exercise includes simple walking, yoga, aerobics, and strenuous exercise like 75 minutes per week of exercise, that is around like jogging, swimming is enough for a ideal health to be maintained. So usually in exercise, what happens? Why exercise is recommended for cardiac patients? So in exercise, what happens is there is a endothelial dysfunction is improving. See, usually when heart patients develop plaques and all, these people will have a basic abnormality called endothelial dysfunction. This is a prerequisite for any plaque formation. So when endothelial dysfunction is cleared, the chance of further plaque formation will be reduced. That's why exercise is recommended for many people at any age group. This is good for many people to prevent cardiac problems.